much, Board. Thanks, Mr Fraser. I'm Dr Anthony Hull. I'm a senior anaesthetist and I'm the Deputy Chair of Doctors for the Environment Australia in New South Wales. I'm actually going to ask two questions. A question pertains to the health impacts of the Beetaloo Basin project and the associated APA pipeline proposed. I note that APA's pipeline project will be a major enabler of fracking in the Beetaloo. I want to talk about the health risk for populations. Populations living near fracking wells and pipelines relate mainly to hazardous pollutant leaks such as volatile organic compounds from fracking fluids and from the gas itself, and these affect air and water, hence the health implications. BTEX, or agents like benzene, toluene and other agents, these pollutants have the greatest associated health risks. There's also an increased risk of widespread ozone pollution above acceptable limits. There are higher rates of leukemia for children who live near fracking wells and pipelines, low birth weight babies, premature deliveries, birth defects, asthma, increased severity of chronic disease. There are also higher rates of premature death for populations that live near gas and oil projects internationally. I'm providing this information based on robust, accepted and recent medical evidence. So the first of my questions is, how can APA proceed with a project related to the Beetaloo project in good faith, knowing these harms? Or is APA comfortable with the idea of a human sacrifice zone, as they're known, around these wells, or Australia's version of Cancer Alley that would be associated with this project? And is this deemed just a necessary cost of doing business? That's my first question.
Look, APA's perspective, as I've said before, there is plenty of evidence. I quoted Alan Finkel. I quoted again that the evidence simply isn't there that it's dangerous. In fact, the evidence is if it's properly regulated, it's completely safe. And there's a heap of research, CSIRO, Macquarie Uni, University of Queensland, ANSTO Research Fund, little to no impacts on air quality, soils, groundwater and waterways. And I could go on about the research that says it gets different conclusions to yourself. That having been said, as I said, there are over 200 different approvals that we will need to go through. That'll have literally thousands of conditions that are imposed, as I said, if the project goes ahead and we're a part of it, that will be imposed on us, and we'll do our very best to comply with them because that's what the process is about, in part to ensure there aren't those health impacts. What's the next part of your question?
Yeah, thank you. Just in response to that, regulating or assuring that there is a lack of these health impacts is incredibly complex and difficult. That's been shown worldwide, and that would stand for this case as well. I should also add that the regulations and the approvals that have to be sought for these projects, they do not involve a strict assessment of the health implications. Unfortunately, that's a weakness of our regulatory sector. My second question is, how will APA manage a potential future legal risk given these facts of the health implications, which I should say are based on the very best and the most recent international evidence that's available, despite how you qualified that in answer to my last question. How would APA manage the risks of future claims made against it for health complications that occur to populations near the fracking site or near the pipeline?
I mean, the obvious answer to that is that we will do everything that we can to comply with whatever conditions are imposed on any pipeline that we may be involved in.